The question we are going to discuss is: state why oxygen deficiency may occur in certain spaces on board ship. Describe the precautions to be taken before entry to any recently opened enclosed space. Why a SCBA bottle is checked before use, and what provision is there for warning regarding the bottle content. What checks are made on SCBA? Let's start with the first part of the question. State why oxygen deficiency may occur in certain spaces on board ship. Oxygen deficiency may occur in certain spaces on board ship. Confined spaces, certain spaces on board a ship, such as tanks, holds, and engine rooms, are considered confined spaces. These spaces are often poorly ventilated and can accumulate hazardous gases, such as carbon monoxide and hydrogen sulfide, that displace oxygen in the air. Fire. A fire on board a ship can quickly deplete the oxygen in the surrounding area. This can create a dangerous situation for crew members who are trying to fight the fire or evacuate the area. In addition to depleting oxygen, a fire can also release toxic gases that can further endanger crew members. Corrosion. Corrosion of metal surfaces can release rust particles into the air that can displace oxygen. This is particularly true in ballast tanks or other enclosed spaces where moisture may be present. As rust particles accumulate, the oxygen concentration in the air can decrease, putting crew members at risk. Cargo. Certain cargoes, such as coal, grain, and other bulk materials, can release dust particles that can displace oxygen in the air. In addition, certain cargoes may release hazardous gases that can create a hazardous atmosphere. Crew members who are required to work in these spaces must take proper precautions to prevent oxygen deficiency. General precautions: all enclosed space access doors, hatches or manholes should be secured against inadvertent entry. It is recommended that all enclosed spaces are highlighted as being hazardous and requiring an entry permit before entering. This can be done using signs and warning notices. An enclosed space that has its access door hatch open to allow for ventilation should be protected to prevent access, using barriers, warning signs or personnel stationed at the entrance. Only trained personnel should be engaged in the duties associated with enclosed space entry. Ship's crews with first aid and rescue duties should be drilled in enclosed space emergencies. Describe the precautions to be taken before entry to any recently opened enclosed space. Precautions to be taken before entry to any recently opened enclosed space are: risk assessment should be conducted before entering any enclosed space. This will help to identify potential hazards and determine what measures are necessary to mitigate those hazards. Obtain permission. Before entry, permission should be obtained from the ship's master or other designated person. Entry to any enclosed space should only be made after it has been confirmed safe to do so. Ventilate the space. Proper ventilation is essential to ensure that the air in the enclosed space is safe to breathe. Ventilation should be established and maintained throughout the entry process. Check the atmosphere. The atmosphere within the enclosed space should be monitored to determine if it is safe to enter. This can be done using gas detection equipment to measure oxygen levels and the presence of any hazardous gases. Personal protective equipment, PPE, should be used as appropriate for the hazards identified in the risk assessment. This may include respiratory protection, eye protection, and other types of PPE. Safe entry procedure should be followed at all times. This includes having a trained attendant present outside the enclosed space to monitor the entry and to provide assistance if needed. Entry should also be made using a safety harness or lifeline. Test communications equipment. Communication equipment, such as radios or intercoms, should be tested before entry to ensure that they are working properly. This will enable those inside the enclosed space to communicate with the attendant outside. Have emergency equipment on hand. Emergency equipment, such as breathing apparatus and rescue equipment, should be readily available in case of an emergency. Let's move to the last part of the question. For entry purposes, steady readings of all the following should be obtained. 21% oxygen by volume by oxygen content meter. Not more than 1% of lower flammable limit, LFL, on a combustible gas indicator if there is potential for flammable gases or vapors. Not more than 50% of the occupational exposure limit, OEL, of any toxic gases or vapors. To warn the user regarding the content of the SCBA bottle, each SCBA bottle is marked with a pressure gauge, which indicates the pressure level of the air in the bottle. This gauge shows the amount of air remaining in the bottle and provides an alert to the user when the air level is low. In addition to the visual checks on the SCBA bottle, there are several checks that need to be made on the SCBA unit itself. These checks include checking the face mask. The face mask of the SCBA unit needs to be checked for any visible damage, such as cracks or tears. Checking the breathing regulator. The breathing regulator needs to be checked to ensure that it is functioning properly and allowing for a sufficient flow of air. Checking the air supply hose. The air supply hose needs to be checked for any damage, such as cracks or punctures. Checking the harness. The harness needs to be checked to ensure that it is properly adjusted and that it is secure on the user's body. Checking the low-pressure alarm. The low-pressure alarm needs to be tested to ensure that it is functioning properly and providing an alert to the user when the air level is low.